Watch your mouth.
All right, and welcome back as we are with our HTV dental expert, Dr. Ryan Walker, always bringing us some great programs and teaching a lot of people about dental health, and we appreciate you being here. Good to see you again.
Good to see you, Martin.
All right, plaque. We've all heard plaque.
That's
Everywhere we go, we're preached about plaque, but let's break it down for the audience. What is plaque?
Yeah, so plaque, I mean, unfortunately, most education that we have comes from commercials, right? So you know about plaque from commercials, and usually it's for a product that's trying to get rid of it, but I don't think most people really know what it is. Plaque is it's a biofilm. To keep it a little more simple, this is just something on your teeth that that bacteria make. You want to think of it as a motel for bacteria. This is where the bacteria exist and live. We're not going to call it a hotel because that would be really too good for these bugs. It's really that white furry stuff. If you don't brush your teeth for a while, or if you're not brushing correctly, you look in the mirror, you feel it. It's kind of what people say that they have sweaters on their teeth. That would be plaque. That's your plaque, the sweaters.
That's a good way to describe it. But why is it so bad? And I guess in a nutshell, why don't we want it?
So plaque is what houses bacteria. So bacteria, talk about our earlier lecture of acid and how acid is bad. Well, if you feed the bacteria can produce acid. And that can produce cavities and gum and bone disease and stuff like that. So bacteria is, it just gives it a place to live. So if you remove it, bacteria has no place to live.
All right. What I want to do now, let's pull up a graphic video of plaque, and then after each video, we'll let you describe it. And there's the first one, Doc.
Yeah, so really, I'm not playing this, want to gross anybody out or anything like that. I just want to show you people what it is, what it looks like, and how easy it is to get off. It's really soft, mushy stuff, and it really isn't that hard to get off, right?
Yeah, right you could tell it's not very, it doesn't look pleasant.
Right, yes. Yeah. So we got another video that shows exactly how, with just wiping it with some gauze, we'll take it off. So the take-home message is really, we're going to get into brushing after this, and that you do not have to brush or floss that hard to remove plaque. And that's really all that the bacteria have to live on is a plaque. So we get rid of that, we get really reducing the amount of bacteria in our mouths.
How do you really get rid of it at the end of the day? What do you do?
So as you saw, it comes off with gauze. So obviously the toothbrush and floss, and it's really what we call mechanical debridement, right? It's just toothbrushing, mechanical debridement with a toothbrush and floss, and it's really not that hard to do.
Now, how long would you suggest to people out there that they actually brush?
So ADA is going to recommend brushing twice a day for 2 minutes per brush, okay? If you want to do more, 3 times a day is even better, and flossing once a day would be great.
So now with all these fancy phones and all, you could just put it on, the timer and time it out. I remember in the old days, Mom and them used to have the little hourglass, but it was 3 minutes,
2 minutes.
Yeah.
2 minutes, yeah. So if you're going to use a manual toothbrush, soft bristles, right? Not a hard bristle, because like I said, the take-home message is that it's not that hard to get it off. And I would say that most people, if they're going to miss a place to brush, it's going to be along the gums. So people think toothbrush, just touch the teeth with it. No, you got to go all the way down to the gums, and that's really where a lot of people miss and where a lot of plaque hangs up. Nowadays, soft bristle, if you're going to use your manual, electric is really what we recommend. Electric's going to do a way, way better job than a manual. And nowadays they're smart, just like everything else. They've gotten smarter and smarter and smarter. They have them now that'll Bluetooth to your phone. You can have an app on your phone. The toothbrush itself is going to time, how long you brush, where you're supposed to brush. It's going to tell you if you're pushing too hard or too soft. And I actually did bring a toothbrush. So this one's yellow, you're not pushing hard enough. Green if you're pushing hard, perfect. And then if you push too hard, it turns red. So that takes that out of it, right? You cannot mess that up. It's got a timer on it. It's got a little smiley face. Really tells you everything that you're supposed to do. There's no excuses.
Technology is unbelievable.
They really have removed all excuses from not being able to brush well.
So, and I know you're a nice guy, but when you're seeing patients and you could tell they haven't been following the protocol, it's really quite obvious, and you got to get them on the protocol and make them stick with it.
Exactly. Yes, exactly.
So there you go. So once again, What is the best electric toothbrush? Is it?
I'm going to recommend this one right here, the Oral-B IO,
Okay.
this last series. This is a great toothbrush, in my opinion, probably the best one on the market.
Any particular reason why you think it is?
So it used to be Oral-B and Sonicare had the two best ones.
Right.
Sonicare had a different action. It had an ultrasonic action. Oral-B had a mechanical action. Well, this last series of Oral-B, they incorporated the sonic in with the mechanical. They combined the best of both worlds, and I feel that this is really the best toothbrush on the market.
Well, if Dr. Walker says Oral-B, then it's Oral-B.
The IO series, yes,
All right.
the latest series they came out with.
All right. We appreciate it as always. Thank you so much. And we look forward to the next show with you.
Thank you, Martin.
All right. There you have it. Once again, Dr. Ryan Walker, our dental expert here on HTV. And we're going to see you again, same place, same time. We love the topics, although sometimes the videos are a little tough to watch. He can make you better and make those teeth shine a lot prettier. We'll be back again on the next episode.
Watch your mouth.